rotators.
That's literally the only range I have like real pain in.
Yep.
Like I couldn't snatch if I wanted to.
Let's start working on a little more in-range control on that stuff today.
Okay. Yeah, dude. What is our movement that
That
we
3 month to 6 month?
Dude, that one is brutal. Like I've been getting that to clients now because that just brutalizes me.
So step by step. Yep. Yeah, pelvic position first. Back down. Remember where our area of focus is. Right there.
See, that's
So let it relax for a sec.
yeah.
So what we're kind of seeing, I'm going to talk to Cameron for a second. So what we're seeing is when we get down kind of right above TL junction, that he has a hard time. McCray is very mobile, so it can suck up a lot of slack. Like we're going to take his t-shirt and do this. This is how he's going to find posterior chain stability. So what we're trying to get him to do is to find a little more neutral palate to work from, and in particular right around like T10, T9, so he doesn't sink where he feels like his scapula is stable by pulling it down a bunch and creating the lack of kind of posterior tilt at the top of his range of motion, create a little impingement, get him neutral, get him moving around that shoulder, and start freeing this thing up. So we're going through a 3 month prone position from here, and he's trying to feel that he's pushed all the way away from the floor, sternum's driving away. His lat is going to chill a little bit, and how we cue him up on that is driving away from me right here. Yeah. And then we find neutral position through the pelvis, so he's going to go through the little, I call it John Wayne, little tuck. And if you watch on him, you're still going to see this. So this is his hardest part, And we're going to let him overcook this for a second. And I'm going to drive up out of that 3 month into a little 6 month transition. You can see how hard that is for him to fix. We're not picking on him. Back down. And take a little break. Those are tough. And that's like the highest level thing we've got for him. But the cool thing is, just like when we were seated in the office in there, if we do a couple of these, we tend to see that his pain at end range flexion changes pretty fast just because we change how his scapula is going to dynamically move. So let's hit one more. The biggest focus is going to be ribs to hips. Through. His feedback loop tells him to do it here. We're trying to get him to do it there, And you can see this hyperkyphosis that he creates. So he's a good athlete, really good compensator. We'll let him get away with a little bit of it. I'm not that worried about it yet. Cool. So just have a seat on the floor. Battery up. For cueing purposes for him, a lot of people, sometimes it's good to load this hand so you can feel like he wants space between his shoulder blades here. Because he's going to have a preponderance to squeeze them together. So we want him, So neutral, we're going to have him flatten his hand, rotate that shoulder back. That's different. And then from there, he's going to try to keep this all the same. He's going to load his knee first, lift his hip off the ground. We're going to swing that right foot around. We're going to get right to that position. So now here's a good position for him. So if we come back over here for a second, Daniel, we're really working crazy, being a good sport. So we want to see that shoulder blade in the same position we were just in. So affixed to the thoracic rib cage out. And then he's going to try to keep that position. That's where it gets tough. The eccentric control of those posterior rotators of the shoulder are really good. Keep externally rotating, And that is nice. Let's go again.
I don't need to let that get loose and break.
So create space. We want space between the shoulder blades. So we're going to pop into a little bit of upper T-spine flexion because that's what he lacks. He's going to create that fixed scapula. And then he's going to load the knee, lift, keeping this neutral. And that's the money move right there. So we could even have him do a little rotation pulse. The whole time he's loading that hand all the way through the fingertips. Now you're going to try to control it back down without this just crashing into a spine. Which that is so much better than last time, right? Yeah. Perfect. Take a little In our first postulation, I don't think McCray minds me sharing, was we had a little bit of labrum derangement, right? Because he's really, again, got a lot of movement. He was doing a lot of Olympic lifting. So if we get more into the anterior portion of the shoulder, we're going to bug the anterior portion of that labrum a little bit, and we can also start to use the bicep to almost peel into kind of a slap lesion. But the cool thing that we're trying to do for him is get him comfortable again using his external rotators, because what he's not wanting to do is go into the position of compromise, which is what we're trying to get him back to. So what we're going to work on today is some in-range external rotation. We're going to have him hold. So now he's going to push down into the squat rack. It's hard as you can for 10 seconds. We're looking for this to stay in the same position as before. We're not going to let him sneak out of that just because we're working on this. So 3, 2, 1. Keeps his elbow fixed. He's going to try to rotate through. So we got in-range external rotation. 3, 2, 1. Back on. Push as hard as you can. Chin comes back. That neutral. And I like this cue. He's got his hand right here. So now we're working on breathing, creating some intra-abdominal pressure. 3, 2, 1. He's going to rotate back in space. So yeah, first move is we're going to take it a stepwise. So go back down for a second. The first thing I actually want you to change is that pelvic position. Yep. Now we're going to load. We're going to create a little space, tuck, and now you're going to try to show your palm out to the front wall. We're going to hold. So now he has no option but to kind of centrate that shoulder, start to move through external rotation. Come in here and kind of help them feel a little bit of straight anterior if you want. And then relax. That's tough drill, isn't it? Mm-hmm. Let's do 2 more. So this first. No. Elbow pin second. Good. And then we're going to try to just show that palm a little bit to the ball. There you go.
On your way to the right foot. Transfer it over.
Hey. Okay. So if you watch what McCray does, I'm going to torture him and have him do it one more time. We're going to look from this view over here. So come on over here for a second. So as he goes through his pull, so first thing we see is he's going to dive way forward, right? So now he's going to go through his pull. And do we see how his shoulder wants to, we call that Voltron. We've talked to McCray about that before. So we're going to start coaching. So let's go back down to the pull position. Okay. The very first thing we're going to do is we're actually going to have him choke down on this. Yep, so grab. Now I want you to think you're going to externally rotate a little bit, right? Because if I was going to snatch, that's about where that handle would be on, about 45. Okay. But I want you to start doing exactly what we did in that high oblique sit, where I feel like I pull this around. Now that's going to continue to pull around as I come up. Does that make sense? Yep. Yep, so go ahead and try to pull. Yeah. Tough to do though, huh? Yeah. There's still pain. Yeah. Okay, a little higher. Yeah. Externally, yep. Better. And again, I want that elbow to feel like it's coming into your torso. It's coming in, yeah. Back down. How are we feeling on that? Good. 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 I think I want this. Yeah.
Awesome. Alright,
A little bit different. Oh yeah. Now is there still pain? Sting that open as you go. Yeah, that's what I want it to feel like. Right? Okay. Okay. Yeah. So again, if we look now, his elbow is literally behind his torso in pull position instead of in front. So he's going to pull through and look at the elbow. Now is that going to happen with the barbell? No. The barbell's going to stop this movement. Kettlebell? Yeah. Right? And I'm also going to never be not open in that pull, right? Because then my hips open and now this is headed over top. Does that make sense? Yep. So the angle of pull is coming from a row almost. We're not completely rowing a snatch. I get that pin behind your torso. There you go. Yeah. Last 2. Last 1.
There you go.
How's that feel?
That feels A-okay on that.
Okay. Try the big one. Yeah.
A little bit of pain.
Good. One more.
Because that's been a solid 3 weeks of
How are those?
rest. That
Okay. How's overhead flexion as far as pain?
Just slight going into it.
Okay. Try to let them know, hey, do we think we actually have tissue injury? Is there something that's like a pathology, or do we just have movement compensation? It's usually a little bit of both. And in his case, I truly think we had an injury, right? We had a shoulder that got compromised due to whatever we were doing paired with, time or an acute injury. But now we're trying to kind of battle anything that was injured, if it is healing, it doesn't matter. We're not going to completely offload it, because what do we know? If I can load that tissue specifically, it's going to heal faster. It's going to heal in a fashion that allows me to do what I want to do with better movement. And the last thing we want him to do is get a shoulder that feels really studly and then go back to pulling in this compromised position, and then he's back in my office a month later. I didn't do my due diligence. So.